Dear Nigerians, as you well know, we have our first index case of coronavirus in Nigeria. A 44-year-old Italian gentleman that flew into Lagos on the 24th of February on Turkish Airlines. He became unwell a few days later, and we were able to identify him and isolate him and perform a test which turned out to be positive. He's in our isolation facility in Lagos and he's doing well. However, he's still secreting the viruses, and so he will have to remain in isolation until he becomes negative for the test that identifies the virus. That will mean that he will no longer be contagious and we may release him back into community. To make sure that this doesn't become an outbreak, we are performing certain containment strategies. The first thing is to identify all the persons that were on the airline that he traveled with from Istanbul to Lagos. The second thing is to identify any contacts he may have had at the airport hotel and then at the place of work where he came into Nigeria for a consultancy. We've managed to identify all the contacts, but we're having some challenges, particularly with the airline. A significant number of people have put false information on the form on arrival, which makes it impossible for us to reach these individuals. We would like to appeal to the general community that these forms were developed for our own safety and for precaution against transmission of this infection to community. You may not be aware that there was a positive case on that flight, and therefore it is important that we are able to reach you and give you this information so that if you develop symptoms, we know exactly what it might be. So it is in your self-interest that you give us correct information on these forms, and it is your civil responsibility to fill out this information accurately. So if you were on the Turkish airline on the 24th of February, the flight number is TK625, arriving from Istanbul to Lagos. Please give us a call on the numbers that we're going to advertise. Or if in fact you know somebody that was on that flight, we may already have their contacts, but we may not. We are promoting some do's and don'ts. Amongst the do's, we ask you to practice good hand hygiene. Wash your hands as often as you can. Use hand sanitizers if you don't have access to fresh running water. Before you eat or when you come back from a public place, make sure you cleanse your hands by these means. Also, practice good respiratory hygiene. If you have a cold and you're sneezing or coughing, cough into a tissue paper, a handkerchief, or into your elbow. And afterwards, try and find somewhere to wash your hands or use hand sanitizers. If you are sick, please stay at home. Do not create the opportunity for you to transmit whatever agent is making you sick to other people at work or in community. So it is better for you to stay at home and recover. After all, by resting, the chances are that you will recover faster. Under the don'ts, don't panic. That's the important thing. The Lagos State government and the federal government of Nigeria have the situation under control. We're doing everything in our power to ensure that we do not have a major outbreak in Nigeria. Avoid touching your face regularly, especially if you haven't washed your hands or cleansed your hands. Don't spit in public, and don't wear a face mask unless you're ill yourself. It's not going to protect you. However, if you are ill and you have to go into public, then a face mask may reduce the opportunity for you to infect other people. Finally, please don't spread fake news. It causes significant amount of damage and wastage of our resources. The Lagos State Ministry of Health and the Federal Ministry of Health are releasing up-to-date information at all times. Please, for accurate information, you can follow us on our regular updates on my personal social media handle or the social media handle of the Lagos State Ministry of Health. Together we can break the cycle of transmission of the coronavirus to prevent an outbreak in Nigeria.
This message is from the Lagos State Ministry of Health. Ìgbéga ìpínlẹ̀ Èkó ó ti di àjùmọ̀ṣe.